Hi everyone, so let's move towards our today's topic, which is
let's move towards the topic that is parathyroid gland. Okay, now we have already discussed that what is thyroid gland. Now this is parathyroid gland. Now parathyroid gland is basically an endocrine gland, and it is present just behind the thyroid gland in the anterior region of the neck. Okay, and what is the function of parathyroid gland? It will secrete parathyroid hormone and parathyroid hormone, and which controls the calcium level and the phosphate level in our body, in our blood. Okay, now parathyroid gland consists of two parts: superior parathyroid gland and inferior parathyroid gland. Superior parathyroid gland is also called as parathyroid 4. Why? Because it is this part of the parathyroid gland is basically developed from the fourth pharyngeal pouch. And if I talk about inferior parathyroid gland, so inferior parathyroid gland is also known as inferior parathyroid 3. Why? Because it is developed from the third pharyngeal pouch. Now what is the location of these two glands? Superior parathyroid gland is located just behind the thyroid gland, obviously, but just behind the middle part of the lobe of the thyroid gland. Okay, where the lobe is present of the area where the lobe of the thyroid gland is present. So basically just behind that part or that lobe of the thyroid gland, you will see the superior parathyroid gland. And if I talk about inferior parathyroid gland, so it is present within the thyroid capsule. Now thyroid gland consists of two capsule, true capsule and the false capsule. So basically inside that capsule, this parathyroid gland is present. Now what is the blood supply? Basically the arterial supply, the venous supply, the venous drainage of the parathyroid gland is same. But if I talk about the arterial supply, so arterial supply of the parathyroid gland is through the inferior thyroid artery, which is very much important. Remember this point. Okay, and as you know that inferior thyroid artery is basically the branch of thyrocervical trunk, and thyrocervical trunk is basically the branch of subclavian artery. You have to remember that thyroid gland is supplied by superior and inferior thyroid artery, whereas this parathyroid gland is supplied by inferior thyroid artery only. Okay, and inferior thyroid artery, I am repeating again, it is the branch of thyrocervical trunk. Now nerve supply is through the superior and middle cervical ganglia. As I have told a lot of times to you that the cervical region consists of the collection of the nerve. In the upper region they will called as superior cervical ganglia, in the middle region middle cervical ganglia, and the lower region inferior cervical ganglia. And if I talk about the nerve supply to the parathyroid gland, so it is through the middle and superior cervical ganglia. Now clinical point of view, it's very important, that's why I am discussing here, that if there is an extension of the parathyroid gland, as you know parathyroid gland secrete parathyroid hormone, and they will control the calcium and phosphate level in our blood. So basically if there is an extension of the parathyroid gland, there will be decrease of the calcium level in our body, and that condition is called as hypocalcemia. And if the secretion of the parathyroid gland, not the extension, if there is an extension of this gland, what happened? Hypocalcemia, the level of the calcium level will be decreased. And if the secretion of the parathyroid gland will increase, that lead to hypercalcemia. Okay, as you know the secretion of the parathyroid gland controls the level of the calcium. So obviously if there is increase in the secretion of the parathyroid gland, it will also increase the calcium level in our blood. And if the blood level if the calcium level in our blood is increased, that condition is called as hypercalcemia. So you have to remember these all points. Till then, work hard, study hard, and good luck. Take care. Bye bye.